Good afternoon, everyone. I'm Nirav Shah, the director of the Maine CDC, and I am joined this afternoon by Commissioner Jean Lambrou, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrou and I are delighted to be able to join everyone this afternoon to talk about where we are with respect to COVID-19 for the entire state of Maine for today, Wednesday, October 6th, 2021. Commissioner Lambrou and I are saddened to report high number of deaths associated with COVID-19. Maine CDC is reporting today 29 additional deaths associated with COVID. And this comes on top of 10 deaths that were reported yesterday. These numbers are undoubtedly high. 22 of today's reported deaths and 8 of yesterday's reported deaths were from our periodic vital records review process. Those deaths from the vital records review process occurred between September 11th and September 29th of this year. These deaths bring our total to 1,065 deaths that have been associated with COVID-19 since the beginning of the pandemic. We'd like to take a moment to offer the friends, family members, and communities of those who have passed our deepest condolences. Right now in the state, there are a total of 93,201 cases of COVID-19, an increase of 836 cases since yesterday. In terms of testing, our PCR positivity rate stands at 4.29% on a 7-day average basis. And our testing volume is at 503 PCR tests for every 100,000 people in Maine right now. As of this morning, there were fewer than 100 cases remaining in the backlog of tests that are awaiting review by Maine CDC. That is a substantial reduction from 1 week ago when the number was in the thousands. This backlog, however, could return. However, as it depends on the number of positive daily results that we receive every single day. The number one thing that folks can do to prevent that backlog from recurring is to get vaccinated, avoid coming into contact with those who may have or do have COVID, all in an effort to keep the overall number of cases down across the state. In terms of hospitalizations, there are 166 people in the hospital right now with COVID-19 in Maine. 1 week ago, that number stood at 225, and 2 weeks ago, it stood at 226. Right now, there are 51 people in Maine in the intensive care unit. 2 weeks ago, that number stood at 88, which was our record. In terms of non-ICU patients, right now, there are 115 people in non-ICU care in hospitals. 1 week ago, that number stood at 155. That day too set a record for non-ICU hospitalizations. Right now in the state, 21 people are on ventilators. There too, 1 week ago, 31 people were on ventilators, and 2 weeks ago, 40 were on ventilators because of COVID-19. Overall in the state right now, there are 60 ICU beds that are available. Turning for a moment to pediatric hospitalizations, something we talked about last week, and I wanted to offer the latest numbers there. As of yesterday, there were 2 children under the age of 18 in Maine hospitals with COVID-19. And in the past 30 days, there have been at least 4. Cumulatively, throughout the pandemic, we've had 34 hospitalizations. Right now, thankfully, neither of those 2 children is in the ICU. And in the past 30 days, there have not been any children in the ICU with COVID. But cumulatively, throughout the pandemic, 9 children have been in a pediatric intensive care unit bed because of COVID-19. Turning now to vaccines and vaccinations. Yesterday, Maine crossed a milestone, or we hit a milestone. 1 million people in the state with at least their first dose of COVID-19 vaccine. I want to focus for a moment today on vaccination rates. Right now, Maine is administering administering about 4,900 doses per day on average and rising. Indeed, vaccine doses administered per day have actually doubled over the past 2 weeks, 103% increase. And they're up over 80% just in the past 7 days. Now that's good news. It puts us back at the level of vaccination that was occurring in Maine back in mid-June of this year. But I want to break down the composition of those 4,900 doses a day to talk a little bit about how it changes and compares between first doses, second doses, and boosters. Let's start with first doses. Over the past 7 days, Maine has been administering about 827 first doses per day over the last 7 days. In the 7-day block preceding that, we were administering about 793. So in terms of first doses, we are up from 793 to 827 just in the past 7 days. Let's turn to second and final doses. Right now, Maine is administering 1,344 second or final doses per day over the last 7 days. In the previous 7-day block, we were administering 931. So there too, on second doses and final doses, we've gone up from about 931 to 1,344. But the real growth over the last 2 weeks has been around third doses, around boosters. Right now, Maine's administering about 2,700 booster doses every single day. In the 7-day block before this current one, that number was about 1,050. So we've gone from around 1,000 to 2,700 doses per day when it comes to boosters and third doses. What does this mess of numbers mean? Well, a couple of things. The first is that vaccination rates were strong to begin with in Maine, and they're up even more now. That's a good thing, because with the Delta variant, it's critical that as many people as possible get vaccinated. Number two, these numbers show that folks are not routinely having difficulty obtaining boosters or additional doses of vaccine. Indeed, we have administered now 35,500 third or additional or booster doses across the state. And the third thing is that it also suggests that boosters are not crowding out access to first or second doses. That's a good thing because, as I've noted, we're just as focused on first doses as we are on third doses. Whether you're looking for a first dose, second dose, or a booster, the bottom line is this: vaccines remain available throughout the state, free of charge, and in most places, you don't even need to schedule an appointment right now. I want to look forward just a little bit to preview a couple of things at the federal level that might be coming our way throughout the month of October. October is going to be a busy month on the vaccine front in particular. The US FDA has scheduled advisory committee meetings on a variety of vaccine topics this month. On October 14th, FDA's advisory committee will be meeting to discuss the scientific data around booster shots for those who got Moderna vaccine. The next day, on October 15th, the FDA's advisory committee will be meeting to talk about the data around booster shots for those who got the J&J vaccine. That same day, they're going to be getting an update from the National Institutes of Health around the mix and match strategy. If you got Moderna to start out with, can you get your Pfizer booster and vice versa? And they'll be hearing and reviewing those data. And then later this month, on October 26th, the US FDA's advisory committee will be meeting to discuss the data around Pfizer's vaccine for children aged 5 through 11. That is one of, if not the topic that I know is top of mind for parents across the state. We don't know what recommendations this advisory committee will make to the FDA. We also don't know if, when, or what the US CDC's advisory committee might say on these topics. Nor do we know what the ultimate decision might be coming out of any of these meetings by federal officials. But what we do know is that Maine CDC will be ready for whatever comes down the road. So with that, We're going to take some questions from our colleagues in the media. Commissioner Lambrou and I are happy to talk about whatever is going on out there. The first question for the day goes to Patty White.
Thanks, Dr. Shah and Commissioner Lambrou. We're getting closer to the end of October when the vaccine mandate is going to be enforced for healthcare workers, including EMS workers. The vaccination rates for EMS workers aren't in the state dashboard. Do you know what's the latest number or figure you have?
So we updated our dashboard for healthcare facilities, that's hospitals, long-term care facilities, last month for the end of August, and we will do the same for the end of September, probably next week on healthcare facilities. I have been in touch with the EMS board and organization, and they are collecting their own data. So we do expect them to have some information in the coming weeks. So we do expect to be updating all that information on vaccination rate among healthcare workers in the coming weeks.
Okay, and there's some EMS departments who are pretty worried. They've already lost or going to lose some people, and for some of them, losing even just a couple of staff members have pretty big consequences because they're already understaffed. So if departments, if they don't have enough staff to cover shifts, once the mandate is enforced, is there any sort of backup plan for the state to ensure the departments can keep running around the clock?
So I'll just begin with the fact that we know that because of the pandemic, the extra work that many people in EMS, in the healthcare sector have had to do has put a strain on those organizations. We've been working around the clock to figure out what type of supports that we can offer to them via, different federal relief funds or different types of staffing models. We've been looking at different types of waivers to make sure that we can keep our frontline healthcare workers going. But the reality is that during the pandemic, we've seen as many, if not more, healthcare workers be out of commission because they're in isolation or quarantine because they have COVID-19. The vaccination itself is going to protect those workers and help keep them on the front line. So we will continue to work to find ways that we can help the healthcare workforce in Maine, generally the workforce in Maine, stay on the job and be present. But we do believe that, as we go into these last weeks, we'll do what we can to do to make sure that those workers are safe, the patients that they serve are safe, and that they have those frontline workers to be able to fill the needs in communities.
Do you know, sorry, one more question, with healthcare workers who have to be quarantined, does that apply to EMS workers? I mean, do you know, I guess, what or how much that applies to EMS workers? I have some departments who say, we've been safe all along wearing PPE. We haven't had a single case, and we'd love it if we could have more time, so we don't lose people. But yeah, so sorry. Do you?
Director Shah, you might want to talk a little bit about how we deal with healthcare workers when they are a close contact of somebody who has COVID-19.
Yep. Patty, I think what the reason that we're focused on this, of course, is healthcare workers who are close contacts, who are unvaccinated, have to be out for quite a period of time. And that has been generating a lot of the staffing disruptions that we've seen throughout the healthcare system in Maine, including in EMS facilities. By virtue of being vaccinated, if they are accidentally exposed on the job by a patient or even by a coworker, they don't need to be out for quarantine. That possibility of eliminating the need to be out for 10 days, we think will really reduce the ups and downs we've seen in the staffing side in healthcare facilities.
Okay, thank you.
Thanks, Patty. Let me go to Patrick Whittle next.
Thank you very much. Wanted to check a number first. It sounded like the state is administering close to 5,000 doses per day. Did I hear that right? 4,900?
Yep, 4,900. That's correct.
And that is an increase from the summer rates that's attributable in part to boosters.
It puts us back at the mid-June rate, Patrick, thereabouts. Yeah. It's ebbed and flowed, but that's about where we were round about 4 months ago. And it is driven partly by boosters, but not entirely. As I mentioned, first doses and second/final doses are also up, not as much as boosters. But again, it's good to see. The reason I went through that is that my counterparts and I in other states were talking about the concern or the theoretical possibility that there could be a crowding out effect. And I wanted to see whether that could be happening in Maine. And thankfully, we're not seeing it in the numbers.
So what were the rates a couple of weeks ago? I know you tossed this number out there, but I wanted to make sure I have this right.
In terms of the overall vaccination rates?
Yeah, per day.
Yeah. So right now, again, statewide, we're doing about 4,900 doses a day. Exactly a week ago on September 29th. Yeah. So exactly a week ago, that rate was 2,700 doses per day. And 2 weeks ago, so a full incubation period ago, we were doing as a state about 2,400 doses per day.
I see. Yeah, thank you for going back over that again for me. Looking at the data, there's still a bit of a rift between some of the rural counties and the urban counties. Could you give us an update on how efforts are going to improve access to immunizations and testing in rural parts of the state?
I'm sure I can start. And Commissioner Lambrou and we've talked about this extensively on both fronts. Right now, there still remains a disparity between vaccination rates in some counties in Maine versus others. We've been really focused on working, for example, as just one example, with commercial and chain pharmacies across the state to make sure that they are fully stocked up and have the vaccine they need to offer boosters, but also first and second doses. The same on the testing front. Commissioner issued a press release just last week to focus on that. The other thing, Patrick, that we've been doing is working with FQHCs more to make sure that they're fully equipped, not just with COVID vaccine, but also, for example, helping them make sure they've got flu shots and things like that. In a lot of rural parts of the state, commercial pharmacies, FQHCs, those are the most accessible pieces of healthcare. We've been working with those facilities on the vaccine front to make sure they've got what they need.
FQHC is federally qualified healthcare centers?
I'm sorry, you are correct, yes.
Perfect. So just sort of broadly, the immunization rate on the whole in the state is obviously high. It's one of the top 5 in the US, but the daily caseload keeps trending in the other direction. I don't suspect that there is, but is there a tidy way of, like, if you and I were in an elevator wearing masks, obviously, how would you explain to me why that is?
I'll give it a shot. I'll try to be pithy, but Commissioner, please feel free to improve upon my pithiness. Here's what I would say, Patrick. It doesn't just matter how many people in a state are vaccinated. It matters where they are in relation to others. So in a state where everyone was uniformly vaccinated across the entire state, rates might be lower. But where in a state like Maine, there are pockets of high vaccination and pockets of low vaccination, the virus still has room to run.
I'll just add that when we look at our numbers, we feel very proud of how far we've gotten, but there's further to go. Just yesterday, I was looking at the numbers, and there are 223,000 adults in Maine who are not fully vaccinated. So compare that to our case count. Our case counts are a lot lower than that. There is still room for the Delta variant to spread, and I think we have seen this historically. While we do encourage indoor face coverings in public settings, we have supported the US CDC recommendation for universal masking in schools. We obviously are encouraging people to be vaccinated, but a lot of this transmission continues to occur in private settings, in private gatherings, in those communities that you identified where the rates are lower, and there's still room for the Delta variant to wreak havoc in Maine. So we continue to say that the number one most important thing that people can do to keep themselves, their families, their schools, and their communities safe is to get vaccinated.
Thank you, Commissioner Lambrou, and thank you, Dr. Shah.
Thanks, Patrick. Let me go to Emily from the Sun Journal next.
Hi, good afternoon. So my first question, I wanted to focus on the vaccine and pregnancy. Last week, Dr. Shah, you mentioned that was kind of the vaccine and pregnancy and fertility was kind of the biggest piece of misinformation floating around that you saw. And, I'm wondering if you could expand upon that a little more, just like why pregnant women should get vaccinated. And then also if you have any data on vaccination rates or cases in Maine, because I know nationwide, I think pregnant women are only 31% vaccinated.
Oh, yeah, you took the number that I was going to use, Emily. That's based on a recent and very thoughtfully done, well done report from the US CDC. But let's walk through why it's important for pregnant women to be vaccinated. Let's start with the most obvious one right up at the top. Number one question, is it safe for me as the mom? Is it safe for my baby? And the answer is yes. As the US CDC report that you referenced, Emily, noted, there has been now extensive experience with pregnant women getting the COVID-19 vaccine and not experiencing any side effects. Nothing suggests that the vaccine is harmful either to them or to the baby. The other reason that it's really important is other data that show that when pregnant women get COVID-19, the outcomes that they suffer, the severity of illness, the likelihood of hospitalization, the likelihood of something bad happening to them because of COVID is heightened. Perhaps that's because of the pregnancy. Perhaps there are other factors at play. But pregnant women, when they get COVID, have worse outcomes than non-pregnant counterparts. The third element is, what about the baby? Well, babies, after they're born, do get some degree of protection from their moms, but that protection can fall off. And that's all the more reason why it's important for those who are around the baby, mom, parents, grandparents, for everyone around the baby to be vaccinated to create as much of a protective bubble as possible. So Emily, that's why it's important. First of all, it's safe for the mom and the baby. Secondly, moms and babies have worse outcomes if they're pregnant and get COVID. And third, after the birth, it's really important to create as much of a protective shield as possible. We'll check and see if we have any further Maine-specific data, Emily, and if we do, we'll certainly get that over to you.
Great. Okay, my second question is kind of getting back to what Patrick was asking about rural versus other areas in Maine. And I saw in a New York Times analysis that September was the worst month in the pandemic for Franklin County. Cases are really all over the place there. And now it seems like, in the Tri-County, central Western Maine area, Oxford County, it's now kind of taking the lead. Can you provide any insight into what's going on there?
One of the things that we've seen throughout the pandemic is sort of a carousel effect, both with states, but as well as within counties in Maine. There tends to be a flare-up, perhaps driven by a particular gathering or sets of gatherings. And then after a high number of folks have been infected because they were susceptible, the virus tends to slow back down. And we've seen that ebb and flow, that carousel, play itself out across the state, not just in Maine, but we've seen it within other states throughout the pandemic. It doesn't necessarily mean that anything with the virus has changed. It's probably just as much driven by local trends, local factors that are driving people to get together in different ways as much as anything else. It's a good reminder that the Delta variant is different from the virus that we were dealing with a year ago. We call it COVID-19 still, but in truth, it's COVID-21. It's different from what we contended with a year and change ago. It's much more contagious. It spreads much more easily, but we're not powerless. Being vaccinated, wearing masks, moving gatherings outdoors as opposed to indoors are all steps that people can take and still gather safely.
I just want to ask a real quick follow-up to that. There's been different points in the pandemic where things seem to be driven by hotspots or outbreaks and then more by community transmission. What do you think is going on right now? Is it kind of a mix of both?
No, it's predominantly community transmission. Almost in every corner of the state, cases that we are seeing are a function of community transmission rather than being driven by focal outbreaks.
Got it. Thank you.
Mm-hmm. Yep, thanks. Let me go to Eric Russell next.
Thank you, Dr. Shah. Commissioner Lambert, good afternoon. I want to go back to the case counts for today. Now, initially, the state reported 300 cases and 9 deaths, and then it wasn't until much later in the day that we got those revised totals. It creates some confusion for our readers, so we had a story up for several hours that we had to revise, and I didn't know if you could help walk our readers through what happened and why it happened.
Sure. So, Eric, we use an automated system to update case data as well as a number of other data elements on the website. When we saw that today's update did not fully reflect the previous 24 hours, we, as you know, immediately sent out a notice to inform the media. We then updated the website as soon as possible. So what was going on? In the last 72 hours or 60 hours or so, we've been working with one of the groups that provides some of the back-end IT support to the US CDC and to states to automate that process of new reports coming in. They'd put in an upgrade to their system. We at least, I can't speak for other states, were putting that upgrade into our workflow. We saw that there was a bit of a glitch in it. That's what led to and so as a result of that, the cases stopped updating as of 11:59 p.m. of last night, rather than reflecting the new cases that came in and were cleared and processed from midnight through 9 a.m. or so. So that's what was going on in the back end. We're on day 700 or so of the pandemic. So these sorts of things, unfortunately, may happen. Thankfully, they have been quite rare.
So just to clarify, when the numbers were updated this morning, it wasn't immediately known by anybody. It wasn't like you guys knew they were incomplete numbers when they first got posted.
I think within probably 30 seconds, if that, made probably 10 seconds, our head of epidemiology and informatics said, the script did not capture everything. It must have cut off at the wrong time. And indeed, that is what happened. It was probably spotted within, I'd be shocked if it was more than 15 seconds.
Okay.
Yep.
The other question I have is, you've talked many times about how with the state's high vaccination rate, we're going to expect to see more breakthrough cases. And certainly we are seeing more breakthrough cases, and we're seeing more hospitalizations as breakthrough patients. Do you have any more insights about who these fully vaccinated hospitalized patients are? Are these older people with underlying health conditions? And do you have any sense yet about whether or not these breakthrough cases, particularly as they result in hospitalization, tell us anything about a waning immune response and the need for boosters? Or do we not necessarily know that yet?
No, we do have some good data there too, Eric. Let's start with the numbers first. As of October 1st, we've had about 4,167 breakthrough cases of COVID-19 in the state. When you compare that against 926,000 people who are fully vaccinated, what that means is 99.6% of people who are fully vaccinated in Maine have not experienced a breakthrough case. So I just want to note that these are, although they happen, they are generally uncommon as compared to the substrate level of people who are fully vaccinated in the state. And that's a function of just how remarkably good the vaccines are, and a function of the fact that what we've talked about, the base rate effect, which is to say a high number of people being vaccinated. Hospitalizations have occurred as well. We've had 164 people who have been fully vaccinated, who have been hospitalized with COVID-19. On average, Eric, those individuals have tended to be older, and they've tended to have background medical conditions. The same applies for those who have passed away as a breakthrough case as well. Tended to be much older and have often had background chronic medical conditions. It's unfortunate. I'm certainly not looking to suggest that they did anything wrong, but that's the epidemiological backdrop. Mm-hmm. Nationwide, what we've seen for all three vaccines is, depending on which data set you look at, and all of this was summarized for the US CDC by the US CDC in a very, very well done presentation that was presented on September 26th. There has been a little bit of waning immunity for infections, but thankfully, all three vaccines continue to show strong effectiveness as it relates to serious outcomes like hospitalizations and ventilators. I want to say that again, Eric. What that means in effect, according to the US CDC, is that what's driving many of the breakthrough hospitalizations is more the fact that there are just more vaccinated people and less the fact that the vaccine is losing its effectiveness. It has lost a little bit, but it's more the math rather than the vaccine that's driving breakthrough hospitalizations. It's an important point, so I want to make sure you don't have any follow-ups there.
No, so I think what you're saying too is to take it out a little further would be to say that it doesn't necessarily increase the need for boosters based on any level of waning immunity. It's not like we got to rush out and get a bunch of boosters because we're seeing evidence of waning immunity. That's all.
Yes, Eric, and 100% correct. I reiterate, getting a booster is important. You should walk, not run there. But the thing that drove the decision around boosters was that they were starting to see more breakthrough cases, but not necessarily more breakthrough hospitalizations after adjusting for population and time since vaccination. But in a sense, the rationale behind boosters was in part to prevent the vaccine from losing that effectiveness. We've seen a little bit of drop off in preventing cases, infections. Thankfully, not yet a drop off in preventing hospitalizations, but we didn't want to get, the US CDC didn't want it to get to that.
Got it. Thank you both.
Yep. Thanks, Eric. Let me go to Brooke Riley from ABC 7 next.
Thanks, Dr. Shah. One quick question for you. We were passed along an article that said something about how Chinese media are potentially claiming the origins of COVID are from a Maine lobster company. Do you have any information surrounding this or any comments on this?
Brooke, I'm familiar with that report. To be candid with you, it sounded fishy when I heard about this. There's not an iota of evidence to support those claims. To be straight with you, I kind of thought they were just floundering for a story. I don't want to clam up about this because I think it's important, but we should call this what it is. It's an attempt by big crab, organized shrimp, and corporate crustacean interests to besmirch Maine lobster's good name, and I won't stand for it. That's why I'm sitting. Let me go to Sean Murphy from Spectrum News next.
Doctor and Commissioner, thanks for the time. I had two questions. Dr. Shah, you mentioned, you referred earlier to the flu shot, and I was just kind of curious because I think it was on Sunday, Maine CDC announced they're going to start tracking influenza cases. I'm curious as to, now that we're kind of heading into flu season, is that going to complicate efforts to fight the coronavirus on your end, or vice versa? Is it going to impact how well people protect themselves against influenza? Do you think people will have vaccine fatigue and not want to go in and get yet another shot? I mean, could you talk a little bit about that?
Yeah, Sean, it's been very much on our minds lately in Maine and nationally. Start off with the reminder, please get your flu shot, folks. You can get your flu shot the same day you get your booster. You can get your flu shot anywhere you get your health care, be it a pharmacy or doctor's office. It's really important this year. We don't know what the flu is going to look like this year. Some folks think it's going to be a bear. Other folks think it might be mild. It's impossible to predict. The best thing you can do is get your flu shot. Sean, you're right. We have been, and for quite a while, publishing weekly influenza reports going back decades here at Maine CDC. And those give a snapshot of where things stand with respect to the flu in Maine and nationwide. We are, as we were last year, concerned about the flu. If it's a bad flu year, it could add strain to hospitals and healthcare workers who have already been working arduous hours making sure that folks in Maine stay safe, to say nothing of the capacity concerns that it could introduce. The other reason we're concerned about it is that if you've got the symptoms of the flu, those are in some respects indistinguishable from the symptoms of COVID. So Commissioner Lambrew and I have spent a lot of time thinking through and working on expanding testing for COVID so that if you do have those symptoms, you know which direction you're going, COVID or flu or something else entirely. So the flu season does present challenges in the midst of a COVID surge or a COVID pandemic as it did last year. But again, as we saw last year, Mainers can do hard things. You can get your flu shot, you can stay safe this winter, and make sure that everyone in your family is okay. Commissioner, you and I have talked about this a lot. I'm sure I left a bunch of things out, though.
Well, the only thing I would add is that we do think that some of the basic public health measures that we do recommend to protect against COVID-19 also work for the flu. Washing your hands frequently, wearing a mask in indoor settings. Those are the basic public health measures that helped us last year prevent Maine from seeing a large increase in people getting the flu. And we're hopeful that people following these measures as we continue to work through our population, including our youngest children who are not yet authorized to get a vaccine, will prevent the flu as well as COVID-19. So we do encourage people to keep it up.
And just so I'm clear, you said you can get both shots at the same time?
You definitely can. You can get your booster and your flu shot, same time, same place, one in one arm, the other in the other.
Thank you. My other question too, you were talking a little bit about gatherings, and I know that Halloween's still a few weeks away, but I think already some communities may try to be preparing for events and things. Is Maine CDC or DHHS prepared at this point to offer any specific guidelines for gatherings, public gatherings, or trick-or-treat or things like that?
So back in May, we did switch from producing our own Maine guidance for COVID-19 to relying on the US CDC guidance, since they really have stepped up in terms of being responsive and responsible for some of the guidance. So I do urge people who are concerned about Halloween to check out the US CDC guidance. I believe they had some Halloween guidance last year. We can double check to make sure they have some coming up for this year, and use common sense. I think we all know the basic rules of wearing a face covering, trying to keep distance, and washing hands frequently as a means of protecting yourself and especially our children who may not be yet authorized to get a vaccine safe.
Thanks, Sean. Let me go to Megan from WMTW next.
Thank you for taking my question. So when you're looking at or evaluating safety in the community, does the booster shot make us any safer collectively, like more so than a second vaccine? Meaning, does one more than the other limit the spread of the virus and or community transmission?
It's a great question, Megan, and it's been discussed. It was discussed by the US FDA and the US CDC, the exact question you raised. I'm going to answer it, but I want to draw a really important distinction right at the outset. I'm going to answer it from a public health perspective, not a personal or private health perspective. I'm going to talk about the state as a whole, our entire population. Looking at it from that vantage point, the biggest bang for the public health buck comes from first and second doses rather than boosters. And again, I'm talking about it on a population level. The best way to squelch the number of cases, get that light at the end of the tunnel that we're looking for, is to get as many first doses into arms. That's where the public health, maximal public health benefit is. Now, that doesn't discount the value from a personal or private health benefit. To the individual, getting a booster may be critical right now. If you live in a nursing home, if you're over the age of 65, or you have a health condition or at a high risk exposure, it's important for you to get a booster from a personal or private health perspective. But from a public health perspective, the thing that's really going to help us turn the tide on the pandemic is first doses.
Thank you. And sort of unrelated, there have been a lot of or more reported cases of RSV from a personal standpoint, at daycares and things. We've heard about more cases than I'd ever heard of before. So, and some of the symptoms sort of cross over. So I would assume, obviously, the only way to be 100% sure is to get tested. But if that's not immediately available, so if your child wakes up with symptoms, what would your advice be to parents who are obviously heightened awareness, not only with coronavirus, but also RSV?
So that's a really good question, Megan. Okay, well, the best advice is, first of all, parents, they always have good relationships with their family nurse practitioner or their pediatrician or healthcare providers that they've worked with in their family to take their kids to. If you're concerned that your kid is particularly sick, they're really out of sorts in a way that they haven't been before when they've had a cold or the sniffles, call your healthcare provider, call that nurse practitioner or that pediatrician, and make sure you're touching base with the professionals. The other is testing is available. Again, and I'll turn it to the commissioner in a second, but we've recently taken steps to make rapid testing that much more available in Maine at locations like Walgreens. your child has those symptoms that could be RSV, could be COVID, because both are circulating right now, getting at least that COVID test is really critical, again, to know which pathway you're going down. I'll turn it over to the commissioner to discuss how we're making testing more expansive.
So last week we did announce that Maine child care facilities may now access pooled testing for children and staff through a federal program called Operation Expanded Testing. There is a organization, Affinity Empowering, that will actually come to those sites to help those child care facilities in low-income communities, help get those children and those staff vaccinated. We urge any child care facility that's interested in conducting a regularized testing program so they can keep their children and their staff safe, reach out to the Office of Child and Family Services, because we really do want to make sure we are giving our child care providers similar tools as we've been supporting schools with to keep kids safe.
Thank you both.
Thanks, Megan. Amy Brown, over to you.
Thank you, Dr. Shah. I think these questions might both be for Commissioner Lambrou. Both are from listeners. One asks, noting that COVID's still very much a threat, but the executive order is no longer in effect, whether or not there's going to be any special guidance from the state or perhaps PPE provided for polling places this fall. There were so many measures put in place last year. Of course, it was a bigger election, but in terms of keeping people safe, will there be any guidance from the state or any practical assistance from the state for polling places?
As I said previously, we are at that phase, given the advance of vaccination in the state of Maine, given the removal of the state of civil emergency in May, that we are pointing people towards US CDC guidance, which often includes common sense measures. So we do urge those who are running local polling places to check out that guidance to make sure that they know what are those right preventative measures to help keep people who are voting safe. We always also stand ready to support organizations that do need PPE. There are the local county emergency management agencies that do take requests for PPE. So we continue our work to supply anybody who needs PPE on a urgent or emergent basis to reach out to their local county officials to request that PPE.
Great, thanks. And the other listener was asking about how is the process of rolling out the boosters going for people who are possibly qualifying because of a medical condition? Are people having an easy time finding a place to get it? In particular, if anyone doesn't have a PCP, will there be any mass booster sites? It doesn't seem like anything like that we're not at that scale, correct?
Yep, I'm going to begin and then turn it over to Dr. Shah, because I think we probably should make a word distinction. We call boosters what older people and certain people recently announced by the Food and Drug Administration need to boost their immunity versus an additional dose, which is what the FDA authorized over the summer for people who are immunocompromised. So Dr. Shah can speak more about the distinction. We have in Maine seen those additional shots that have been provided over the past almost 2 months now, I believe. So we have been providing them. We have heard that there's no access problems. They are being provided in all of these sites that are available to people, be it the pharmacies, doctors' offices, healthcare providers' offices. The reality is that most people who qualify for an additional dose who are immunocompromised are seeing doctors fairly often for their conditions. And those physicians, those healthcare organizations tend to be providing those additional doses on site because the importance of those additional doses for people who are immunocompromised. But Dr. Shah, I'll turn back over to you to see what I missed.
Sure. Thanks, Commissioner. Amy, with respect to the large scale sites, we do still have some in Maine. They may, in Waldo County, they may be a bit of a drive from, but we've still got the large scale site that York County EMA is operating in partnership with us in Sanford. Our colleagues over in Lewiston and Auburn are operating a site at the Auburn Mall, both of which I was taking a look at the numbers are doing multiple hundred shots per day, including boosters and these additional doses. So we still do have that option, but we are also working with other channels pharmacies, independent and commercial, doctors' offices, moving vaccination into those venues as well. As the commissioner noted, we have not heard of challenges with folks obtaining them. The numbers don't suggest that there are challenges, but we're always keeping our ear to the ground. If we see access challenges, then we're ready to adjust course and respond.
And do you know if someone goes to a pharmacy to get their booster shot, if they have to bring proof of a qualifying condition, or if they can just tell the pharmacy that they have one?
It's a great question, Amy. They do not need to prove or document their qualifying condition or occupation. The US CDC has asked states to work on or work off of a self-attestation model.
Great, thank you.
Yep. Let me go to Brian Sullivan next.
Thank you, Dr. Shah. So similar to, I believe, Emily's question about Franklin County, I would ask you about Penobscot County and what you're seeing there. It seems consistently to be at or near the top of the state in terms of daily new cases.
Yeah, you're right. And although I didn't go through the demographic data, Brian, but we'll be posting it and sending it around as well. A high number of the deaths that we've seen just in the last 2 days are among residents of Penobscot County. There too, we're seeing in Emily's questions as well as yours, Brian, one of the through lines between those are more rural counties with lower vaccination rates in comparison to more urban counties with higher vaccination rates. And the through line, be it Somerset, Franklin, or Penobscot, is regions of those counties where there remain pockets of unvaccinated folks. That's where the virus is spreading. That's where folks are getting sick enough to be required to be hospitalized in Bangor or Lewiston or Portland. And sadly, that's where many of the deaths that we've seen just in the recent days have come from.
And that being driven in addition by small gatherings or any information about things of that along those lines?
I wouldn't restrict it just to small gatherings, Brian. I would refer to it more broadly as community transmission, that including small gatherings at folks' homes, other types of social events, anywhere where people are congregating for a period of time with poor ventilation, long duration. That's where we're seeing cases emanate from.
And then I just to go back to some of the numbers you gave us earlier, and I'm not sure if you have this data. I guess 827 first doses a day is the number you gave out, correct?
That's correct. That's on average over the past 7-day period.
Okay, so I guess to put it, sum it up, how many people could have gotten that since, say, last May and are just now getting it? Do you have that information, or how many people you're perhaps getting through to or are being convinced to get this first dose? And maybe if you do have that information, what are they saying is the reason?
I get what you're saying. I don't have a number, Commissioner. If you have a way in your head to tabulate a number, I'm happy to talk about what people are saying because we've tried to keep tabs on that. But Commissioner?
Well, the eligibility rules for first and second doses of Moderna, Pfizer, and Johnson & Johnson had not changed since April. We do know that it takes work, especially for youth, for whom there is an extra layer of consent to ensure that people know about it, understand the pros and cons, recognize where to go and how to do this. So we do know that there is always a learning curve. There's always some time that gets taken between when somebody becomes first eligible and somebody gets their vaccine doses. And we do continue to see daily progress. Director Shah mentioned that we crossed that 1 million person threshold yesterday. We're approaching 80% of adults in Maine being fully vaccinated. So we keep making progress. All that said, we know we have more progress to make. We do post the vaccination rates by our school administrative units, so we can really be tracking at that level where are our greater needs to vaccinate youth. We are tracking our school staff vaccination rates. Those are going to be posted for the second time in the coming weeks. We already mentioned the healthcare worker vaccination rate. We continue to use all of our tools at our disposal to try to continue to push that rate up so we truly can protect people of Maine from this deadly virus.
Brian, I'll just note, we've been at the Freiburg Fair offering vaccines there, and one of our public health nurses relayed that in conversation with an individual who got vaccinated at the fair, our nurse asked that individual, "Why today? Why'd you come in?" Commissioner noted, you've been eligible for a while. Why today? And that individual said, in effect, well, I wanted to wait just to make sure everything was okay, and saw that there have been billions of doses administered around the world, and literally billions of people have gotten it. Seems like it's safe. Seems like it's keeping people alive. That was one strand. The other, which is something I read in the paper, but another individual who was a healthcare worker noted that it was a condition of her employment going forward. So those are two recent reasons that I've seen, and we've heard that repeatedly.
Thank you.
Thanks, Brian. Let me go to Caitlin Andrews next.
Good afternoon, Dr. Shah, Commissioner Lambrou. My first question is about the pool testing program. Now, I know this data is going to update tomorrow, but right now the state's dashboard shows there's a 45% overall school participation rate, but a pretty varied amount of participation in the various school districts. Do you feel like the state has an accurate insight into whether COVID is present in schools?
I'll begin. We actually don't use that particular set of information to figure out what is going on with COVID-19 in schools. We have a whole team of school nurse coordinators who do work with schools on their practices, on their case investigations, on their contact tracing. So that's a separate process. Pool testing is one of several tools that any school may use to early detect and isolate kids and teachers and staff in schools to keep that school extra safe. So it is a measure like universal masking, like other preventative measures that a school may use. We do know that there is a curve that is going up on adoption of pool testing in schools. The schools are continuing to get the consent from parents for pool testing for their students. So we do expect to see those numbers increase. But again, I think there's a difference between the use of pool testing as a preventative measure from the use of pool testing as a surveillance measure.
100%. I would have said that exactly the same way. And, we think of pool testing as an early warning system. It's not the full-on 100%, 360-degree disease surveillance. That's what we do with our case investigators, our epidemiologists, school nurses. That's what they do in concert with each other. Pool testing is just the early warning system.
Okay, and so a second question that I have is that two media organizations have reached out to us saying they are not being allowed to ask questions on these briefings due to time constraints and them being advocacy reporters. Can you tell me how the CDC is determining which media outlets are allowed to ask questions on the briefings and how that policy squares with the First Amendment?
So maybe I will answer that one and just say, we have made a choice here in the state of Maine to do these briefings regularly. Previously, it had been more frequently, then it was less frequently, and now it is in a medium frequency because we want to have another forum in which we can communicate our briefs on what's going on and be able to answer the questions in the space of an hour from a set of credentialed reporters. It's not the only way that we answer questions. We do take questions from the public, from other outlets, from constituents all the time, and we do our best to try to answer those questions. So we just want to say that we do a fair amount, we think, to communicate to Maine what's going on in COVID-19 pandemic and response. We'll continue to do that, including answering questions, not just within this forum, but outside of this forum.
Well, I would certainly agree. You guys do a lot of outreach for us, and we appreciate that. But I guess, isn't it difficult to determine who might be considered credentialed media, who is able to ask questions on this particular forum and who is not?
I will so.
Yeah. Go ahead,
No.
Dr. Shah.
Yep. No, we don't think it is.
Thank you.
Yep. Let me close out by going to Chris Costa.
Hi, Dr. Shah and Commissioner Lambrou. Certainly heard my voice plenty on these, so I guess I feel a little guilty. I guess I'll just get right into the questions here. Dr. Shah, last week you had kind of hinted at some expansion of testing. Is what you were talking about last week, but you weren't ready to announce, is that the announcement that the commissioner had made on the 30th about expanding the Walgreens and such? Okay, great. Cool, we got that out of the way. In which case, I would just ask the commissioner, what was the impetus to kind of make that happen, to make that kind of come into play, especially for the childcare facilities? Why did that? What changed, I guess?
So we've been looking for those opportunities all along. As a reminder, we feel fortunate that a lot of the funding that we get to support our testing programs comes from the federal government. So we were able, for example, to use the very specific school funding from the US CDC last spring to launch the pool testing program that we've been talking about. We learned over the summer of this other opportunity that I just mentioned, this expanded testing option that is for certain communities. We reached out to them, we've been working with them, we had webinars with them, and now we are able to connect that new testing program to our child care centers in Maine. We've been looking for those opportunities all along. And we, even in the spring, when we launched our school testing program, did offer our child care providers rapid testing guidance to facilitate it. But this new program just is one click easier because there are people who literally help you set up the programs. So we're grateful for the federal government for offering us that opportunity. And we're not done. We will not be done until we take advantage of every single opportunity that comes down the pike for the state of Maine. We have other options that we're working on to expand testing. We know we have some testing gaps still in the state of Maine, Washington County, for example, a few other places that we have targeted for expanded testing to make sure that all people in Maine have access to timely testing. So we will continue to look at all types of options for testing to make sure that when people want or need a test, they have it available and local.
Okay. Was there something you were going to add, Dr. Shah?
Nope.
Okay. I will move on. My next question is a viewer question. And I think that just to preface it, I think it has to do with maximizing a person's immunity between either a final dose, a booster shot, a potential natural immunity. So I'll just read you the question, but I wanted to kind of preface it by saying that. It says, if a person has a breakthrough case of COVID-19, when would be the best time for them to get the third dose for the longest lasting immunity? And the second part of the question is, does having had the vaccine and then the virus give the individual more immunity to have natural and vaccine immunity? Your thoughts?
Got it. Let me answer those in reverse order, Chris. There are some, and interestingly, this was a subject of a briefing from the US CDC yesterday to state health officials on the latest data here. Let me answer the latter. The latter question was, does the combination of having previously had COVID plus getting a shot or the full series of vaccine, is that preferable? Yes, it is. That's why the CDC recommends that even those who had COVID do go ahead and get vaccinated. There are some early data to suggest that the combination of pre-existing immunity from having had COVID plus the vaccine really turbocharges the body's immune system. The former question was around when somebody who had a breakthrough case should go and get their booster, provided that they're eligible. And the answer there remains, in general, when they become eligible for the booster. Right now, that recommendation is for folks to get their booster shot 6 months after they got their second shot. Of either right now, it's just Pfizer, but that may change in the near future. With one important caveat, which is if you are actively recovering from COVID, if you're within that 10 days of your 6 month shot, you shouldn't be going outside anywhere. You should be at home in isolation so you don't get other people sick. But after you're free and clear from having recovered from COVID, then again, you should walk, but not run, to go and get your booster shot.
Got it. And this last question is for the both of you. And Dr. Shah, I know I asked you this last week. I asked about the most common piece of misinformation that you hear, and you had said it was surrounding fertility. Is there a number two most common? And Commissioner Lambrou, is there one that you're hearing most often, a piece of misinformation about why someone might be hesitant to get the vaccine?
Commissioner, I'll let you, let you please.
I've heard one that bothers me a lot, which is I can't afford it. The COVID-19 vaccine across the nation in the state of Maine, there's no charge for it. It is free. This is being bulk purchased by the federal government. And here in the state of Maine, we work very hard to make sure you can access it without paying anything. So if you're worried about the cost of the COVID-19 vaccine or the booster or the second dose, just rest easy. There is no charge for the COVID-19 vaccine.
Okay. And Dr. Shah, did you have one?
Nothing more from me, Chris. I think that's spot on. We've certainly heard that as well.
Okay, then I'll just round it out by asking you this. There are plenty of reasons why a person may choose to not, or at least wait to get the vaccine, whether it's philosophical or religious, or perhaps they have a medical exemption or an allergy to something in one of the vaccines. Is there a way for you guys to kind of, I don't know if quantify is the right word, but how much does misinformation play into vaccine hesitancy from what you guys can tell?
Boy, I'll start, but again, Commissioner, please. I think it's one of the principal driving forces behind hesitancy, if not the singular driving force. As you noted, Chris, not entirely. There may be medical reasons or religious or philosophical reasons why folks are still on the fence, but misinformation, improper scientific findings, misconstrual of statistics, those have become so widespread now that I fear that people have internalized them to make them their own identity. And so now my concern is that rather than simply trying to correct the scientific facts, misinformation has become so pervasive that folks have incorporated it into their identity. And that's a much more difficult thing to overcome. It's more than just about correcting the scientific record. It's asking people to abandon core beliefs that they may have had. That's a challenge. It's not just related to vaccines, but I think we see it in so many areas of science right now.
I'll add kind of on a note of optimism that we have seen people do change their ideas. They change their identities. People do evolve. This is not like a barrier, which is like, for example, what we experienced early in the pandemic, where we struggled to get those testing reagents. So even if we wanted to, we could not do sufficient testing of COVID-19 in the state of Maine. That was a barrier that we struggled with overcoming, but it was not a barrier like misinformation, which if we do, again, people do learn. There are messengers that they listen to. There's people who, may have been of that identity who listen, learn, have a family member, have somebody they know who gets ill with COVID-19 and change. So we remain hopeful, and our own data suggests that we have reason to be hopeful because we continue to see the number and rate of people getting a COVID-19 vaccine in Maine rise.
Completely agreed. So thanks a lot, Chris. And thank you all for taking some time out of your afternoon to join Commissioner Lambrou and me today. We appreciate thoughtful questions, and we appreciate everyone taking some time to get up to speed on where COVID is. We look forward to chatting with everyone again next week as well. But in the meantime, as always, please be kind and take care of one another. We'll talk again soon.